and welcome to yet another edition of Total Wellness. My name is Jacinta, and I'll be your host. With me here today is Dr. Yama, and we're going to have a very interesting discussion. I know you've heard about post-traumatic stress disorders, and we're not sure what that is, but that's why we have her here. So, Doc, please enlighten us. What is post-traumatic stress disorders? It's quite a mouthful.
It is a mouthful. So we often say PTSD, and most people kind of relate to it quite easily. But I think the name kind of helps us get what it is. So post-traumatic, so that means after a traumatic event, or a traumatic stressful event, and then the disorder that comes out of it. The challenge becomes what is traumatic and what is not traumatic.
Exactly.
So there are some definitions that will help us kind of break this down. First of all, is kind of a common sense approach, which is quite simple. So essentially, any stressor or any event that a majority of persons, when they experience it, would have some psychological stress from it, major, severe, is kind of gives us a baseline for it. But then to be a bit more specific, then we look at the nature of that trauma. One of it is that it tends to be something involving life. Okay, so it's catastrophic in nature. So it's something, a major thing, it's a big deal, not the everyday things we experience. So sometimes it will involve someone dying, so someone probably witnessing a traumatic death, or being in a space where the person's life is at risk. Okay, the person is in a place where they could easily lose their life, or either themselves or others around them get hurt, serious injury. So not I cut myself with a knife, but like a very serious injury. Something like sexual violence also comes to play as well. Um, in addition, sometimes too, it's not necessarily the person experiencing it themselves. There are a few cases, for example, first responders to an accident or a disaster having to pick up dismembered parts of human beings. That is, though they didn't witness it happening, the experience is quite traumatic in itself. Or we have some persons, by the nature of their work, for example, police officers who continuously hear very detailed accounts of some traumatic things, so rape, violence, all of that, keeping hearing about these things. Those are the kind of things we look at when we are talking about trauma. So it's kind of a bit more intense in nature. So after the wars, the natural disasters, those I think readily come to mind. But some of these other things are in addition as well.
You gave me quite a graphic description, and I'm almost scared just thinking about it. So I can imagine people having to go through these things. But then again, I was going to say that, I mean, in Africa, we experience more traumatic events. So let's talk about the female genital mutilation. Will we call that a traumatic event? Even just witnessing that. So let's say your sibling watches that happening to you. Could that be the secondary aspect you're talking about?
Well, it's generally for now, it hasn't necessarily been classified in that group per se, but then the nature of it, even with female genital mutilation, there are different levels at which it's done based on the incision. So it's kind of supposed to be more like a surgical kind of procedure, but then in a crude form. So there's no real risk of life or death per se with that, especially if they are doing more the minor one, clitoris, but then sometimes can be quite extensive as well. So based on the nature of it, it could have a potential. Then again, we are different, so some people might really get a bit more alarmed by that kind of scenario. But then for our text so far, I think it will be good on our part to kind of publish research a bit more in that regard, and then also see the extent of its impact on persons immediately and afterwards as well.
Yeah, because the first time I knew about it, I think I watched it on the 7 o'clock news, and I was traumatized for the longest time. I mean, I just watched on TV, so I'm just imagining what it would be. So yeah, that research would be very interesting. So how do you, I get the courses, but how does one come about getting that experience? Because, like, say you witnessed an accident on the motorway, you saw these bodies, head, things all over. Immediately, you think you're fine. And then later on, so how does one realize that they're actually suffering from this disorder?
That's a really good question. And the thing is, for most of these things, recall I didn't kind of talk about us watching on news and all that. That would definitely have its place, but it wouldn't lead to a PTSD per se. Okay. So there are different types of disorders. So with what I explained, usually after the experience or the stressful situation, we give ourselves within the first 6 months, the person starting having these severe psychological distress, which captures things like the person reliving those scenarios, the person becoming a bit more hyper aroused, such that, so maybe I'll break these down later, but then a bit more easily startled by sounds and things that kind of just,
you of
yes,
what
and then that may lead to the person kind of avoiding situations that might look like what they experienced, and there might be some change in the person's essential mood or how the person generally is. Some of these traumatic events might occur just once. So it's a one-off. Let's say you had this, there was a natural disaster happened this once, but some might be kind of repeated. Yes. For example, someone living in a home where they are being repeatedly sexually abused. Exactly. So that one might be a bit more repeated in nature. So that might lead to a more complex type of PTSD though. However, if, let's say, the person experiences this, as you said, so immediately, some might not even notice they are experiencing something, but there are a few who might have some initial response to that kind of exposure. But we give ourselves within a few days to a month, would not classify it necessarily as a PTSD itself. So we might talk of it as an acute stress disorder at that level. But then when it's beyond that period, into that first 6 month period, then we'll be thinking about the PTSD a bit more of, yes. So, yes.
Okay, Doc, with all that you have said, it seems it must be hard diagnosing somebody with PTSD.
Well, when it comes to the actual practical work, most of the time, not really, because the characteristic features are present. The person becomes, they're reliving the experience. The person doesn't even want to talk about, have conversations about the subject matter. They might have challenges with recurrent intrusive images, thoughts of the experience. The person, trying to avoid situations that can easily remind them about it, amongst others. So with the clinical criterion, it's not too challenging, especially once you're able to communicate well and get the history. Once you're able to identify the main initial trauma and then link it up with all of these other presentations, difficulty sleeping, nightmares, having all of those experiences and linking them up to the trauma that the person experienced. And more importantly, also identifying that the trauma in its nature was of that gravity, then making the diagnosis is not too a challenge. Where sometimes there's a challenge is where persons might experience some stress, but then it's not of that gravity. Then we are looking more of an adjustment disorder. So I think maybe per our training, we get to understand these nuances so you're able to kind of just identify where the diagnosis goes.
Because I was going to say, people grieve differently. People are different by nature. Yeah. So say you witness an accident, or maybe you're in an accident with your parents and they both died. I mean, I think that is traumatic. That is. But what if they are just going through a grieving process and they're not necessarily suffering from PTSD? What then? So maybe you can just enlist the symptoms of PTSD so that if you're watching and you're suffering, I mean, you contact her as soon as possible so you're helped.
That's great. So it's good you brought up the subject of grieving. Grieving is a normal, natural response. So that is not a PTSD. Grieving often would lead to the focus is the loss, the person that has been lost. So all the emotions, all the experiences are in relation to that loss. And it generally runs a course for most people within 6 months, maximum a year. For healthy grieving, it's kind of wrapping up on its own. There are some times when people can have a pathological or an not normal form of grieving where they might need some help in addition to recover essentially from that loss. However, PTSD, as I said, the focus is the trauma that has been experienced, but then some of the symptoms that have occur afterwards include one, as I said, reliving of the experience. And with that, it can happen in varied forms. So some people might have recurrent thoughts, images of that experience. So the person might be reliving that thing they experience. For example, a lady who is sexually abused might have some dreams where she feels like she's being abused again
Or
or
even if
having
somebody is
nightmares.
trying to hug you, you just
Exactly.
react
So some would even
crazily.
distance from men altogether because they're trying to avoid, distance themselves from anything that might remind them of it, or even a space or an environment that's kind of reminds them of it. So it happened in a hall or maybe in a certain kiosk or something. Once they're passing by, it's something that reminds them of that experience. It kind of triggers the feelings and emotions, anxieties that is in response to it, and they'll try to do anything to avoid that. And with some persons, even if they're relieving, for some persons, the memory of the experience might become patchy. So they might actually forget some important details of it because it's like having it in mind is really, really distressing. So some people would actually blank out some aspects so they can't even recall it altogether.
Isn't forgetting a good thing though? I mean, or you'd always know there was something wrong, and so you'd wonder what happened. How does that
So it might not necessarily be forgetting per se. So it might be some parts
bits
of it, but then it doesn't change the fact that the person has all of these
build up?
emotions and
Yeah.
these repercussions of feelings from the experience. So it's not necessarily the person's forgetting, but then having a challenge. So I had a young lady. She was in SHS actually, and she was sexually abused by her teacher while she was in a junior high school. And hers actually started manifesting as if she was having seizures. So for a long period, it started when she was much younger, but I saw her when she was in VHS, and it was being managed as some form of seizures and all of that. But then after we discussed, even with a child and adolescent psychiatry, going back in her history altogether, then we realized that that was
Oh
the
Lord.
bedrock of it. So it was leading to her avoiding men. It was leading to her having some apprehension towards some persons, and then having some nightmares as well, even years after. So it can run a chronic course, especially when it's not when there's no intervention as well. Most people would have some challenge with sleep. Oftentimes being woken up with very vivid dreams, very vivid dreams. It's like it's so real that you're in there. The flashbacks is when people feel like they are back in that situation, even whilst they
I
might even
mean,
be awake.
imagine a little girl having to go through seizures because of one cruel act. I'm just wondering, that must be really, really hard. So tell us about the treatments.
Okay.
Are you able to treat them so they forget completely, or is this a long term? It's like managing the thing. How's the treatment like?
So the treatment is not necessarily aimed at forgetting, but then appreciating that it has happened, but then how to deal or handle those emotions a bit better, how to face all of those emotions in a way that is not so detrimental to the individual self, because it can impair one's function extensively. So there are different modalities as well. One of them is the psychological interventions. So with that especially, so most of the time we do cognitive behavioral therapy, but this one is a bit more tailored. So it's called trauma-focused cognitive behavioral therapy. And there's some other psychological interventions as well, EMDR amongst others. For some people, when they show up initially, they might be in a state where they might not necessarily be able to engage well with psychological intervention, maybe the symptoms, the intensity, and all that. So they might need some medications to also help get them in a better position. So some medications can actually help with that. So we have some antidepressants that might help. There are some other medications that might also be brought into play based on the person's presentation as well. So those are the two main forms of treatment that we kind of use in managing persons with PTSD. And it's not all gloomy per se. So majority of persons, about 50% of persons have been found to actually do well within a year of
Right.
getting treatment, but quite a number, also 30% might have it running a chronic course. But then the aim is to ensure that the person is able to at least live a more optimum life, not having impairing their functioning to that extent, because it can really affect relationships, it can affect person's social setting, home, work, maintaining work, it can be very challenging. Some people even have adverse coping mechanisms. So some might take to drinking alcohol, some might take to using
Substance
some substances,
abuse,
just
exactly.
trying to handle all of these things that they're experiencing. So once you're able to curb all of those things, it can have a good outcome.
So with those who are not willing to go through therapy as yet, because reliving the experience is just, maybe puts them in seizures or gives them another whole mental situation. Um, don't they, isn't it possible they can become dependent on the antidepressants and that's how come they go into the substance abuse?
Okay. So I just want to clarify. So with the young lady, it wasn't an actual seizure she was having. So it's what
Okay.
we call
It
pseudo
seems
seizure.
like,
So
yeah,
yes, so it represents that you might easily think
it
it's a
is.
seizure, but then when you assess, you realize it's not a proper true seizure, but it's something that looks like a seizure. Yes. So with the treatment, as I said, so the cornerstone is the psychological treatment. So that's the main focus of the treatment. And so the medication is just to help get the person in a place where they are not so in an uncomfortable situation whilst they're going through the process. Because mind you, psychology or psychological treatment is not one day. It is a journey, and everybody progresses at their own pace.
You need to
You know,
trust you.
exactly. Even how you have a good relationship with your therapist,
Yeah.
it has some impact on how well you do. So it's you can't really predict for each and every person, but then we kind of add the medications, especially when it's needed, to help the individual through. So it's not everyone that might do medications based on the assessment. Some people might do purely psychological therapy, but if there's a need for medications, we'll bring that in. And the aim is not to keep the individual on the medications for life,
Okay.
but then as soon as the person's symptoms are improving, we gradually taper them off, watching the symptoms amongst others. So that's how we kind of manage it. There are few that might end up on the medication for quite a while, but the plan is never to do long-term or for life kind of therapy. So as I said, 30% might have this running a chronic course. They might need some of these things. For war veterans and others, it can be quite
So
challenging.
let's situate this in Ghana. It seems like a foreign concept, and but in Ghana,
Yeah.
especially with your experience on the ground, would you say this is a prevalent condition? And tell us about how some of the success stories, so that anybody who's watching is encouraged.
Okay. So that's true. It myself, prior to getting into the field, I actually even thought it was something that's
It
about for
cannot
you
be
know
exactly. I
that
mean, we cannot
experience
have
is
this
not
in
a
Ghana.
Ghanaian thing.
Yeah,
And even with the different forms, I thought, oh, right now there's no war, there's no natural disaster,
they just go for
nothing.
peacekeeping and come. So I mean,
Exactly.
what?
But then you'll be surprised that we just had a batch of persons, Ghanaians, who ended up on some contracts. And for theirs, it was quite interesting because they didn't even know they were going to a war zone, but they ended up in a war zone.
These are military
Recently,
men,
yeah.
soldiers,
No, not military
normal
men,
people.
civilians.
Oh
So
Lord.
they're supposed to be doing some artisan work, but they thought they were going to one destination, but then realized they were in Iraq and they're experiencing the war. And this happened a few years back. And they show up now with symptoms that are
I
in
mean,
line
nothing
with that.
prepares you for something like that.
Exactly. And also with us as well, one of the common things we do see is the sexual
I mean,
abuse
yeah, you
that
get
tends to
old
happen.
men raping children, and
That tends to happen. And quite often, you see, the thing is, quite often because of our culture, we try to settle these things out of court, try to families talking and getting, but then sight is lost of the victim. And sometimes we think, oh, once it's been spoken about between families, we've settled it, they've paid something, then everything is okay. Meanwhile, the person, there hasn't had a resolution because the person did it. The person's walking around, they are seeing them all the time, and it's like there was no outcome to it. The person didn't pay for anything. So it has a lot of effect on individuals. So you get to see quite a number of people experiencing these things. Mind you, also, we have persons who also, even assaults and some form of robberies amongst others, some can be very violent,
violent, yeah.
even at point of almost
Gunpoint,
losing
yeah, yeah.
one's life, and we've had some of these
Slashing,
things
yeah.
happening in the country. So people might not even know to even get help, but then these things can happen. So someone coming to your home, and there was a point where there was a lot of armed robberies going around as well. So all of those things are things that can even get people to experience certain things. And we have the carnage on our roads is
Another thing.
it is terrible, and sometimes first responders, even when I see some of these images, when I think with those who survived some of these things, and also even persons who might go in first responders just trying to help and having to see pulling people out of these wrecks, the body is dismembered, that alone is enough to get people to experience these things. Recently, there was, I think, some children drowned in yes, in one of our regions. The Mental Health Authority organized some psychiatrists and psychologists to go there to give some first aid, recognizing that some of these repercussions can happen. So I'm not. We don't think that it's not happening. I think the challenge is that most people are not
You don't come out.
reaching out for that professional help. And sometimes they might either end up in the spiritual. Most of us spiritualize a lot of things. So most will end up in churches. Most will end up trying to deal with it in our cultural way of handling these things. And we're hoping that most people will get more professional help because help is available.
But isn't it also possible that they think it's pretty much expensive?
Well, the cost bit, I will not, I can't argue much about. Fortunately, at least cost in our general or government hospitals, psychiatrists, is relatively low compared to even the other general hospitals. So the cost of services at Accra Psychiatry Hospital, Pantan Hospital, generally or Ankafo will be much lower compared to that you would pay in even other government hospitals that are general medical service, offering general medical services. Challenge is that there's a lot of stigma attached to these facilities, so if I'm having flashbacks, if I'm having some difficulty sleeping with nightmares, and I'm easily startled by sounds I'm hearing because I experienced something, someone will say, does that equate to psychiatric hospital?
Exactly.
Why don't I go to the nearest hospital where I can
Easily get help.
get help? So that's where the dichotomy is. As for the private psychiatric services, that is quite expensive.
So you heard her, it's not that expensive to get treatment. If you have suffered some form of traumatic abuse, please see a health physician. We're going for a quick break and we shall be back. Welcome back from the break. If you just joined us, you're watching Total Wellbeing. And we have here with us Dr. Nyama. My name is Jacinta, and we're just talking about post-traumatic stress disorders. My question, Doc, is that between females and males, which gender is more prone to PTSD?
Okay, so that's another interesting one. So this is one of those conditions where, well, I'm not going to say fortunately or unfortunately, but then research kind of shows that women tend to have a bit more higher risk of experiencing it. So for our data, we would say men will be around 18 to 13 to 18%, and women are around 20 to 30% likely to experience post a traumatic event. So generally, females tend to experience a bit more or at higher risk of experiencing it than men.
But are females not emotionally stronger though? So I'm surprised that we tend to be of the higher.
I think, well, it could be different factors that come into play, but then considering the nature of the trauma we're experiencing, yes, females are quite resilient compared to with the things we experience day to day. Exactly, we experience so much that we're able to endure and thrive in the midst of. But then the way we handle certain things also still plays with how it reflects in our emotional capacity. So you would notice a trend. So with depression, women are twice as likely to experience it compared to men. And the anxiety disorders as well have similar trends as well. And so with PTSD, it's not too far-fetched though, especially considering the gravity of these things. I wouldn't want to say men are more built to be tough and all of that because they also experience these things. But I think the gravity of what happens.
They are more the perpetrators of the act.
Probably, we're talking about, but then that's I think is off the
far from it. Yeah,
that's just us joking around it. But then also looking at things like even sexual abuse. It's yes, men can be abused sexually, but the majority of those experiencing these are women as well. And now, too, initially when we were talking about the military or even combat, it used to be a thing for just men, but now women are finding it, going into everything as well. So if you're talking about even home natural disasters amongst others, women will still be in there, but the impact might be a bit different for a woman compared to a man with regard to even laws amongst others. So I think it does have some role to play, but that's what the data definitely shows us. But it would be nice to elucidate even more than what we've spoken of so far.
What about the age ranges?
So age range, no one is spared exact from PTSD. Well, maybe I'll say babies because they might not necessarily even probably understand what might be going on. But even with that, there might be some show of what might repercussions to it. However, with children, theirs might not. They'll definitely once they experience things like abuse, in a home that is quite
Toxic.
yes, toxic and all of that. They would actually show these might be in a bit different form from adults. So you might notice that they may be having a lot of difficulty sleeping with some bad dreams and all that. But then in their play, you'll notice them having themes around the issue that is in focus. So the themes around the play might you elucidate that this trauma is something that is continuously having an impact on the child.
So teachers, as you watch your children play during, break time, I think that's a very key point. You should watch those signs. Sometimes that's the best way they can communicate what they're feeling, and that should really help.
Yeah. Even drawings as well. You see these things coming in.
Cool. So please tell us about the risk factors.
Okay, so the risk factors are diverse. So there's some that we kind of link to the vulnerability. So we'll say that persons of low income tend to be a bit more at risk, and then also persons of relatively lower level of education compared to those of higher level of education. But that doesn't necessarily absolve any person who is of a higher income status or higher educational level. But just as been noticed that persons of the lower end of the spectrum tend to be at a little higher risk
Why
of experiencing these. Well, it might, as we said, vulnerability, so it might make them a bit more vulnerable to these things. So if you're talking about even abusing someone, generally it might be a bit easier to do it for someone who is of a lower level than someone who really is out there, well to do, they know all their stuff, you might not take exactly. So it puts them at a higher risk because of the vulnerability. Some texts will actually even put in Afro-Caribbeans and then some Asians compared to some Caucasians. So that's in those kind of settings because also the vulnerability, in some societies where it's mixed, persons of certain background or races tend to be a little more disadvantaged compared to others. So that might put them at risk as well. And not wanting to just talk out of context, but then looking at the US, for example, sometimes with some states and which are predominantly blacks, the level of crime, the level of assaults and all of those things, they tend to be a bit more exposed to such florid violence and trauma, so that might also affect the rates that they might see in such cultures. For us, we are all same, so that's really much. As said earlier, females, so females as well have a higher risk compared to males. So those are some of the risk factors that you would see. And then we come to the trauma itself. So the nature, as we started from, the nature of the trauma itself, the severity, amongst others. Those also would, based on the nature, might put someone at a higher risk of experiencing compared to other forms of trauma.
I'm just going back to why people don't come to the hospital. Could it also be that they don't think they would receive the adequate care, or that's not the case with your specialization?
I think it's definitely a lot of factors go into mind. Not getting adequate care, that I'm not too well aware of. I think most people are more perceive the psychiatric services as more of something for, quote unquote, someone who is mad. someone who is gone off completely. So with our setting, most people do not attach such things as needing mental health services. With regards to the kind of feedback they would get, I haven't been made know, or I've not come to know any of these concerns so far from our clients. Majority, after coming in, are quite impressed at compared to what they were expecting and what they experienced. And the feedback is usually quite positive. And most would say, "Oh, they wish they had done so earlier." But I
That's
think
reassuring.
the stigma is a huge. That is a major thing. People try to see anywhere apart
And
from there.
so we just need to educate people more so we don't stigmatize people. Now, tell us about yourself. I mean, as you see this every single day, I mean, how does it tell on you? How do you condition yourself to just see that it's work, it's not? Tell us about that.
That is an interesting question because rightfully, I mean, so it's not like every day you're having a PTSD or very bad cases. There are some days that your client will make you actually happy. The challenge is, I wouldn't deny the fact that there are some cases that can really pull on your heartstrings. You know, there are
Will
sometimes,
keep
and we
you
have
late night
these
thinking.
discussions where we discuss some forum where we discuss some cases, clients, you know, so that everyone can contribute to how we manage them. And there are some cases when we are discussing, I just tell them like it just pulls at your heartstrings. You know, you cannot not be emotional about it because these are human beings who are experiencing these things and having the repercussions of them. So it takes a toll on you. And so for myself, sometimes, you know, talking about it, even amongst colleagues, you know, airing out what these things are, helps us to cope. And personally, I also use mindfulness as well. And some of these cognitive skills we discuss with clients, you kind of also use it
For
on
yourself,
yourself
yeah.
as well, because there are times where you have to just take a break. There are times where you'd have to just kind of bring yourself back to the present, take your deep breaths as well, and think of yourself. Sometimes when you go and leave, you know, you kind of give yourself a break so that you focus on other things. Recreational activities also help. So I personally have some gardening I do in-house, so it's more of indoor plants, taking care of them. Family, children are supportive. So there are a few things that help me distract from that. And I think the major one for me, and this is very personal, is spirituality. For me, that is my bedrock. You know, so in everything I come back to my source. Okay, and for me, I find that very, very fulfilling. I find rest, I find peace, and if anything is beyond me, I kind of leave it in the hands of the one I know I can trust. So that's how I cope. That's how I
And
cope.
I mean, that's the best way anybody can cope, regardless of, I mean, with all the treatment and everything else, it's just one person, our very source. And so when life seems to be overwhelming, let's just know who to go to. Thank you so much, Doctor. This has been super enlightening. So please seek treatment early. Thank you for watching. See you again next time.